like to start by thanking Council Members Grosso and Shea and other members for allowing me to testify today. So my name is Dr. Jarvis. I'm a pediatrician in the community, and I represent the District of Columbia chapter of the American Academy of Pediatrics. The DCAAP is the Washington, D.C. chapter of a national organization of 64,000 pediatricians. The D.C. chapter has over 400 members, including pediatricians, residents, and medical students from all of the district's hospitals, community clinics, private practices, and school-based health centers. I am here today to speak about the health effects of lead exposure to children, yet it is actually very simple. Any amount of lead in a child's bloodstream is harmful. On a molecular level, the brain confuses lead for calcium and thus allows it into the brain. Once inside, the lead triggers cell death within the brain and decreases neuronal connections. Lead exposure has a multitude of effects on children. At high levels, lead poisons a child and can be fatal. Its effects on the brain can be so severe that seizures and comas develop. At moderate levels, we can see symptoms immediately, such as headaches, clumsiness, drowsiness, and agitation. They can easily be missed or confused with behavior problems in the school. However, it is the insidious, constant low amount of lead exposure that frightens me the most. These children often have no initial symptoms, but studies show that as these children get older, they will become more inattentive, hyperactive, disorganized, and less able to follow directions at school. They will have higher high school dropout rates and reading disabilities. Though this hearing is focusing on lead in public facilities, it is important to remember how exposure may be a compounding factor to other exposures in children. Currently, the most common exposures to lead for children come from older homes via paint and household dust, ingesting soil and water through lead pipes. The idea that any amount of lead in a child's bloodstream is dangerous was not always accepted in the scientific and medical community. In 1991, the Centers for Disease Control and Prevention recommended to physicians that a blood lead level above 15 micrograms per deciliter, or 150 parts per billion, should require further investigation, case management, and close follow-up. By 2005, the blood level that required that type of workup was 100 parts per billion. Now, we use a blood lead level of 50 parts per billion because of recent research that shows long-term cognitive delays in children with those levels. Given this trend, what do we expect the recommendations to be in 2025? Would anyone be surprised if new research shows that 10 to 20 parts per billion of lead in the bloodstreams have some sort of negative effects on children? We already know how lead works in the body and brain. This is why the American Academy of Pediatrics believes there is no safe level of lead, and DC pediatricians agree. The AAP recommends water fountains in schools do not exceed water lead concentrations of 1 parts per billion. Unfortunately, we do not have the research and data to confidently say how the amount of lead in water corresponds to a blood lead level. However, we do know that it is significant. But again, I would refer back to the evolution of our understanding of lead's effects on children. Our previous assumptions have always overshot the mark. Collectively, we have a history of failing our children when it comes to this issue, previously here in the district and recently in Flint, Michigan. So it's time that we err on the conservative side and eliminate any and all lead exposure. Thank you.
Thank you very much. Mr. Cochran, good morning.
Good morning, Chair People, Grosso, and Jay. My name is Todd Cochran. I've testified before the Education Committee. I'm the parent of 2 rising second graders and a rising pre-K 4, if you can say that, at Capitol Hill Montessori. In addition, I'm beginning my second term as the vice president of our PTSO, and I'm a Ward 6 resident. I testified before the committee on the 14th of April, right after we discovered the delayed communication, if you want to call it that, from the lead test. Commissioner Brown discussed that. I'm not going to rehash that here before the committees today. I agree with Councilwoman Che that there are a lot of problems here in terms of we're not confident in the testing used. We're not confident in the remediation, if it's effective and sufficient. And also the communications of the problems is what I'm going to focus on today. I certainly wish that the government witnesses would testify first today in light of last night's press release from the mayor from DGS. That would be helpful, I think, but I understand that's not the way the process works. So our school was the first school that discovered, if you want to use that term, the delayed response, delayed information about the lead testing. We, of course, raised quite a commotion. We got a lot of attention at the very beginning. We had a meeting in April with DGS, and our community was very unsatisfied and actually pretty angry about that. There was a deputy communications director from DGS who ran the meeting who did not allow the subject matter experts from DGS to talk to our community and answer our questions. We, of course, followed up about that. We had another meeting in early May that involved the Deputy Mayor for Education, DGS Director Chris Weaver, DGS staff, and DOE Director Tommy Wells, and DCPS pediatrician Heidi Schumacher. At that meeting, we were told repeatedly this was not a health crisis, and it seemed that they were telling us that our fears were a bit unfounded. In fact, Director Wells said that the testing of lead in our children that was occurring was, quote, more of a PR or goodwill gesture done to reassure parents. You can imagine how that statement went off in our community. People were not happy about that. So the point through all of this is that the communications has been poor throughout. I recognize that steps have been made by DCPS and DGS to remedy that, but we still believe that it can be better. When I closed my testimony on the 14th, I wondered a question that if this was the way the lead issue was handled, what other problems might be lurking in our school and through DCPS in general. Our school definitely needs a full modernization, as do many other schools in DCPS. And it seems like DGS has recognized that to a certain extent. They have been responsive to us in the last couple of months in fixing a number of health and safety problems at our school. They're including us in their summer blitz. I believe that the lead in the water is a very significant problem. I agree with Dr. Jarvis that no lead in the water should be safe. Although I'm not a doctor, I agree with her scientific analysis of that. I think it's a symptom of larger things, and I hope that the mayor, DCPS, DGS, and DOE follow up and fix these systemic problems in regards to all schools in DCPS, the libraries, DPR, everything else, charter schools as well. Thank you for your time.
Well, thank you all very much for coming down and testifying. I appreciate it. Dr. Jarvis, I particularly appreciate the effort that you guys have put in on this issue here in D.C. The more that we can elevate the conversation and get it into the public eye, I think the better chance we have of remediating all of the issues. When you guys chose to do 1 part per billion as your model, did you go into any of the analysis on whether or not that was, how can I say it? I mean, it's not like that it's impossible, but how hard would that be to accomplish? Have you seen that in other jurisdictions? Is this something that you took into consideration in your studies?
I have to say, in all honesty, I was not part of that consideration. I've reviewed the policy extensively, but I do have a context for the experts that put together that policy, and I would be happy to get back to you.
I mean, I tend to agree. I mean, I think that remediating down to 1 part per billion or below that is really smart. Because I think, as your science shows, we understand that any kind of exposure is dangerous for development of a young mind. And I guess the other question I would have is around just where you mentioned in your testimony that it's not just water, but it also is the dust and the paint particles and the other things that are around. When we renovate a school or modernize a building, usually we remediate all of those things, asbestos, lead, in lots of different ways. But the water seems to be the tricky one because I'm not sure if they're not doing all of the pipes or if there's something that, maybe I don't know if anybody wants to add to this, but I think one of the things was that they found high levels of lead in water sources that were not used frequently. And then when they flushed them out, they got rid of the water, which I think goes to Mr. Branham's point, got rid of the lead in the water, which goes to Mr. Branham's point around, it's the pipes that are leaching into the water, somehow the lead. And I just don't, I guess I'm ready, willing, and able to say it should be zero, right? But how do we get there? What is the practical implications of that? I'm certainly not going to pay to renovate everyone's house in the District of Columbia to get rid of all the lead pipes in the city. Is there some other way to do it? Please.
I can start and then please pass it along. So I will actually refer you to the AAP policy statement under the section lead in water. So as you mentioned, there are several different sources of lead in the water. So that can be the solder, the brass fittings, lead pipes, and then sometimes even partial replacement of the lead pipes or service lines isn't sufficient and can actually temporarily increase the lead in the water as well. Some proposed solutions have been, of course, replacing the lead lines. However, that may not always be feasible. Water filters that are certified by the National Sanitation Foundation for lead removal can effectively reduce water lead concentrations. And then in some instances, the residential units, the idea of flushing the water for 1 to 2 minutes prior to use.
So should we put these certified filters then on every potential drinking source in the District of Columbia, regardless of their testing results? I'm serious. I have a Brita filter at home. I use that one. I think it works pretty good, but I don't know. I mean, and I'm curious from your expert opinion. I mean, I'm trying to get to a solution here. And so when we put in protocols that are standardized, I'm not sure if we should replace every single pipe or we should add filters everywhere or we should do both or what. And I remember when this happened back in the early 2000s in D.C., there was lots of different problems that contributed to lead in the water. One of the main things that it was the way that they treated the water at the treatment facilities. If everyone remembers, when they changed the levels of some treatment, that caused problems. Well, is there something there that we need to do now as well? And I'm just curious, has the science caught up with this yet since then or not?
To be honest, I'm offering a pediatrician testimony.
Right.
I don't have the evidence in front of me about the lead levels in residential areas in Washington, D.C. To answer your question, should filters be placed everywhere? I think it would depend on those levels. As we've stated, the AAP do not believe that any lead level in children is acceptable. And so I believe that if there was evidence of lead in the water throughout the district, that we would need to kind of attack or find solutions to that problem.
I appreciate that. Thank you very much. Councilmember Che?
Thank you, and thank you